Hey everybody, thank you all for joining us here today, and for those watching online, thank you. I'm Aaron Groff, Communications Officer here at the County of Santa Clara Public Health Department. Today we're talking about the latest on the county's monkeypox response in both English and in Spanish. There will be time for media here for Q&A as well. We also have a personal statement today from a member of our community and community leader, but we want to start off first by bringing in Health Officer and Director of County of Santa Clara Public Health Department, Dr. Sara Cody.
Good afternoon, everyone. Good to be with you as always. So I just wanted to be sure to share what we know about monkeypox here in Santa Clara County, just to give you an update of where we are and what we're doing. So as of yesterday, we have 39 residents of our county confirmed with monkeypox. And we're, of course, concerned not just about those who have monkeypox, but their contacts. And of course, we want to do everything that we can with all of the tools that we have to prevent further infection. So the infection is still rare, and we would like to keep it that way. It's important to understand that really anyone can get monkeypox, since it's mostly spread by skin-to-skin contact. But currently, the infection is spreading mostly within social networks of men who have sex with men. And so most, but not all of the cases that we have identified have been among men who have sex with men. So similar to COVID and other infectious diseases, we do keep data to understand who's becoming infected. This allows us to do a better job of focusing our efforts on prevention and treatment. And so what we know now, of the 39 people with monkeypox, a little over half belong to the Latinx community. And as I said, most are among men who have sex with men. And this is similar to the pattern that's being seen in other parts of the Bay Area and across the country. So given this pattern, we are partnering with LGBTQ organizations in the county. And I really think that we could not do the work that we're doing without the trust and the partnership that we have. That is absolutely true. Some of the partners that we're working with include Aki, Project More, the Billy DeFrank Center, Silicon Valley Pride, the Gender Health Center, Valley Homeless Healthcare Program, and Q Corner. And one of the important, of the many important things and work that our partners are doing, it's helping outreach to make sure that people most at risk get appointments for a vaccine. So remember, the vaccine needs to be given for someone with a known contact, like after their exposure, but also to people who are most likely to be exposed before they get exposed. And that's where these partnerships have been absolutely critical. So today was the first day of the county vaccination clinic at the Fairgrounds Expo Hall, where we've had the COVID vaccines. We had hundreds of appointments for the monkeypox vaccine already booked. And we will continue to work with partners to make sure that we get people at high risk in for appointments when we have vaccine available. So a little bit about the vaccine, what we're experiencing here in the county. So far, just 662 doses of vaccine have been administered countywide. Most of those, or 611, have been administered by the county, and the rest by large healthcare systems. We did allocate some vaccine to our healthcare partners. After we finish giving vaccine to those who have appointments at the fairgrounds, we have a little supply left, which we give to people who've had a known exposure to someone with monkeypox. And just this afternoon, actually within the last hour, we received news of an additional allocation of vaccine from the state. This comes from the federal government to the state government and then to the counties. And we'll get a little over 700 doses additionally coming into the county. We don't know exactly yet when those will arrive. So we'll continue to prioritize those who are great at risk greatest risk to get the vaccine, and that we do in collaboration with our partners. So I'm happy to answer questions. I think I'll stop there. I just want to close by saying that a little silver lining in difficult times. We have a lot of experience through COVID, and our teams are ready and doing what they know how to do best. And we're also extraordinarily lucky to have the partnerships that we do with the organizations that serve the LGBTQ community, because I don't think that we could protect people as well without those partnerships. So I really want to express my enormous gratitude to our partners. Thanks so much.
All right, and so right now we do want to bring in one of our local community leaders, Ugho Badu with Colectivo Acción Latina de Ambiente is going to be joining us now for a personal statement.
Buenas tardes. Mi nombre es Ugho Badu. Soy cofundador y coordinador de Colectivo Acción Latina de Ambiente o Colectivo ALA, una organización en San José operada por voluntarios que sirve a la comunidad latina LGBTQ más que habla español. La comunidad a la que servimos está conformada principalmente por inmigrantes, muchos de ellos sin documentos, con barrera de idiomas en el inglés, sin acceso a un seguro médico y con horarios de trabajo complicado. Por si fuera poco, nuestra comunidad latina LGBTQ ahora enfrenta la propagación de la viruela símica o viruela del mono de manera desproporcionada, colocándonos como la segunda comunidad más afectada en los Estados Unidos hasta la fecha. El número limitado de vacunas disponibles y el acceso inmediato para nuestra comunidad pone a prueba una vez más la resiliencia de nuestra comunidad. Afortunadamente, la respuesta pronta del Departamento de Salud Pública del Condado de Santa Clara es alentadora. Colectivo ALA está actualmente colaborando con los esfuerzos del condado, ayudando a diseminar la información acerca de las vacunas y educando a nuestra comunidad acerca de la importancia de estar protegidos contra la viruela del mono. En este esfuerzo, queremos agregar que la identidad sexual o de género de una persona no es la causa de transmisión de esta enfermedad. Y queremos hacer énfasis que aunque un gran número de casos se han registrado entre hombres que tienen sexo entre otros hombres, cualquier persona está en riesgo de ser contagiado si está en contacto con una persona infectada. Urgimos a la comunidad en general a mantenerse informados para evitar propagar no solo la infección, sino también la discriminación en contra de una comunidad que ha sido históricamente discriminada. Si trabajamos juntos, podemos salir adelante. Gracias.
All right, Ugho, thank you for sharing your words and joining us here today. We do have time now for questions from the press for Dr. Cody and Ugho. We're going to go down the line here. If anyone has a question first. Just in Spanish today. Yeah. Question.
Well, I think there's sort of two parts to that. One is there's, what a state of emergency would do would be to help free up resources. I think here in Santa Clara County, as in most communities, what we really need is vaccine. We need to get ahead of this. And the way to get ahead of it is with more vaccine and getting vaccine into arms of people who are most likely to be at risk. And so anything that can help achieve that goal is important.
Is there any concern about creating a stigma in the LGBT community, Q+ community, when I believe it was who said, men who sleep with men should you know, create some space within themselves. This is not a sexually transmitted disease. So is there any concern about the narrative and how this message is being put out?
Thank you for your question. Your question is around creating stigma. And how do we make sure that we don't contribute to any further to stigma? Here's what's important to know, and Ugho mentioned this in his remarks in Spanish. Monkeypox is spread by skin-to-skin contact, so it doesn't have anything to do with your sexual orientation. As it happens, infections first began within a network, a social network, of men who have sex with men. And that's where we're seeing cases. Doesn't have anything to do with your sexual orientation. Could just as well have begun in a community of wrestlers who also have a lot of close skin-to-skin contact, right? So we need to describe who's getting infected so that we can do outreach and education and prioritize vaccine. So we need to talk about it, right? We need to talk about who's getting infected so that we can reach people and protect them. But it is very important to know that it doesn't have to do with your sexual orientation. It has to do with the behaviors that allow the virus to spread. And that's, close skin-to-skin contact with someone who has a rash.
Given that, any theories as to why it's spreading in the Latino community? We also don't want to have to stigmatize that.
Right. I think the question is, why would this infection be spreading in the Latino community? We don't want to stigmatize the Latino community either. That's exactly right. I think the point is the same, that it really is just, where do the infections start in a network? This just sort of reflects where the infection happened to start in a particular network, and that's where it spreads. It will change. We saw this during COVID. It started in some communities and then moved to other communities. So that's, viruses don't particularly care. They have a way that they spread, and they're just going to follow their pattern. And we in public health need to describe who's getting infected so that we can mobilize resources. And that's really the bottom line. We are advocating as fiercely as we can with the federal government, as is the state of California. We badly need more vaccine.
On the vaccine question, Los Angeles is getting their vaccine from the federal government rather than other models like Santa Clara. I understand that LA has been able to get a lot more than jurisdictions who are getting it from the state. Have you been trying to get it directly from the federal government? Are there any efforts to do that?
So there's LA County has a different relationship with the federal government, and a lot of grants come directly to the county that don't go through the state. And, many resources go directly from the federal government to large jurisdictions like LA County and other large jurisdictions in the country. Santa Clara County, as you observed, gets allocations via the state. The state has a formula in order to allocate the very scarce supply across the counties, and it takes into account, among other things, how many monkeypox cases we've reported. So they're doing their best. The bottom line is there's not enough vaccine.
So you're saying that the LA County has a different relationship with the
Right.
federal government than Santa Clara County does?
Correct. And this has been true for decades and decades and decades. They get direct allocations. So I can speak to this, and then Ugho, would you like to make comments in Spanish as well? So I'll do in English and then in Spanish. So the monkeypox virus, someone with monkeypox will frequently get a rash, and it's these very characteristic bumps that blister and then crust over. And the rash is infectious. So, and you can have the rash lesions on your skin, in your genital area, in your mouth, And so contact with any of those, any parts of the rash will spread the virus. You can also get the virus, if you have a rash, it could be on your bedclothes, your bedding or your clothes. And so you could get in contact with the virus by contacting contaminated bedding. Much less efficient way of spreading the virus, but possible. But the primary is, someone, it also in respiratory droplets. So, through when you're, breathing, coughing or sneezing, but that doesn't seem to be quite as common. So people with a rash should cover up. And, just sort of a really basic tip, before having sex, we ask people to consider, do they have a rash? Does their partner have a rash? Have sex if you're rash free, and otherwise go see a medical provider and get your rash diagnosed. Ugho, do you want to talk in Spanish a little bit about transmission?
Sí, es un poco de ambas. Básicamente sale el sarpullido en la piel, y si la persona está en contacto directamente con esa persona con el sarpullido, puede infectarse. También se puede infectar con la costra o si está segregando algún tipo de líquido. Si la persona que está infectada está portando algún tipo de ropa o tiene contacto por ejemplo, con la ropa de cama, y otra persona tiene contacto directo con esa ropa que ha sido impregnada con la transpiración o con los líquidos que está transpirando el cuerpo, puede ser también infectada. Otra manera de transmisión es manteniendo relaciones íntimas con una persona que tiene el virus, ya sea por besarse, por abrazarse y obviamente por tener relaciones sexuales. Pero sí, respondiendo a tu pregunta, sí se puede contagiar de ropa si es que ha estado en contacto con una persona infectada y hubo líquido de la persona que está padeciendo la viruela del mono.
We have time for two more questions. Stephanie.
So with this new allotment that's coming in, are we expecting to see any change in the distribution costs, especially considering that this report is going to be smaller clinics in certain communities, kind of like what we saw with COVID?
So the question is, with the next allotment of vaccine, how will it be allocated to make sure that we reach people most at risk? I think that's your question. So what we are doing is we allot some to our healthcare providers, but most we keep in the county because we can, in partnership with organizations serving the people who are most likely to get infected, they can help those individuals most at risk make appointments. So it's by appointment only at the fairgrounds. And we want to make sure, again, that those who we're most worried about get in for an appointment. And that's what we're doing. We don't have plans right now to do mobile teams, but we certainly could if we need to do that. Again, there's not that much vaccine to be able to allocate across a lot of different strategies. Well, so we've been, as we did throughout the pandemic, collaborating across the Bay Area region because, we kind of people work and play as a region. And so some residents from other counties have come to our clinics, and our residents have gone to clinics in other counties as well. People who are most at risk would be people who have multiple sexual partners or who attend venues, bathhouses or venues where there are sex parties or any kind of opportunity to have multiple sexual partners. So that increases your risk because it just increases the chance that you'll come in contact with someone who does have monkeypox.
Time for one last question here.
Data on age. I don't have the exact, but basically, the average age is sort of 40s. So it sort of ranges from 20s to 50s, but most cases are, in their 40s. Okay.
Here. Thank you. And we're going to bring in Diana as well. She's going to read the statement in Spanish.
Muy buenas tardes, mi nombre es Diana Dávila, vocera del Departamento de Salud Pública para el Condado de Santa Clara. El Departamento de Salud Pública del Condado de Santa Clara da a conocer la raza y el origen étnico de los casos de la viruela símica o viruela del mono para fortalecer aún más el alcance crítico con los socios a los más afectados en la comunidad. Entre los diagnosticados con la infección de la viruela símica o viruela del mono, un número desproporcionado se encuentra entre los hombres latinos e hispanos, similar a los patrones observados en otras jurisdicciones. En el condado de Santa Clara, el 41% de los casos se dan entre hombres homosexuales y bisexuales, hispanos o latinos, en comparación con el 26% de latinos en la población del condado de Santa Clara. Cualquiera puede contraer la viruela símica o viruela del mono. Sin embargo, este brote actualmente se está propagando principalmente entre hombres que tienen sexo con hombres. El Departamento de Salud Pública recopila y analiza la raza y el origen étnico de los casos de la viruela símica o viruela del mono para asegurar que los recursos y la información se comparten donde más se necesiten. El Departamento de Salud Pública se asocia estrechamente con las organizaciones comunitarias LGBTQ para llegar a las personas que actualmente se consideran de mayor riesgo de contraer la enfermedad, para conectarlos con la prevención, las pruebas, el tratamiento y la vacunación. El departamento vacunó a más de 500 personas referidas por estas organizaciones en 2 clínicas de vacunas la semana pasada, con más clínicas planificadas a medida que el suministro de vacunas esté disponible. Hasta la fecha, de los 39 casos totales de la viruela símica o viruela del mono en el condado de Santa Clara, 21 hispano-latino, 8 blanco no hispano, 6 asiático o isleño del Pacífico, 2 negro o afroamericano, 2 desconocido. El recuento de los casos es relativamente pequeños y las proporciones por raza y etnia podrían cambiar a medida que se identifiquen más casos. El condado ha solicitado más vacunas a través de procesos de emergencia y de rutina y continúa abogando por un mayor suministro tanto por las clínicas operadas por el condado como para los sistemas de salud para vacunar a sus propios pacientes de mayor riesgo. El condado no ha recibido confirmación de ninguna fecha de entrega de vacunas adicionales. El Departamento de Salud Pública continúa trabajando activamente con los socios de comunidad LGBTQ para aprovechar la confianza que estas organizaciones han construido para asegurar que las poblaciones afectadas y en riesgo estén debidamente informadas y capacitadas para protegerse. Además, el condado de Santa Clara también está abriendo el salón de exposiciones de los terrenos de la feria para la vacunación contra la viruela símica o viruela del mono hoy, con 380 citas ya reservadas para el miércoles y el jueves. Debido al suministro limitado de vacunas por parte del gobierno federal, las vacunas contra la viruela símica o viruela del mono en los terrenos de la feria se proporcionarán actualmente por invitación o con cita previa solo a aquellos que tienen el mayor riesgo de infección por la viruela símica o viruela del mono. Las citas están actualmente llenas y se abrirán más citas una vez que llegue el suministro de vacunas del estado y del gobierno federal. Las citas se pueden hacer en bax.sccgov.org. La viruela símica o viruela del mono es una enfermedad rara causada por la infección con el virus de la viruela símica o viruela del mono. Recibir una vacuna antes de la exposición o poco después de la exposición, idealmente dentro de los 4 días, pero hasta 14 días después, puede ayudar a prevenir la infección con el virus de la viruela símica o viruela del mono. Para obtener más información adicional sobre quién es elegible para la vacuna y otra información sobre la viruela símica o viruela del mono, visite sccphd.org/viruela del mono. Gracias.
Thank you all for joining us today.